Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for this show. My guest today is Judy Esterquest. Judy is the chair of the Healthcare Issue Committee of the New York State League of Women Voters, which is a powerful advocate for all of us on healthcare here in New York State. Judy, welcome back to North Country Matters. It's been about a year since you've been on the show to talk about the New York Health Care Act, its provisions, and how it could solve a lot of the healthcare problems we faced in 2025, which are more dire now and acute a year later. So, like every other safety net we used to enjoy before January 2025, healthcare has been shredded by the Trump administration. Let's review where we are, please.
So, Medicaid funding slashed. Funding for high stakes public research slashed. Public health institutions like CDC and National Health Institute gutted. Trust in vaccinations undermined. So, we're already seeing preventable diseases rampaging in parts of the country, with a future of more diseases and more devastation. Safety net hospitals are threatened. Rural health care devastated. Maternal and healthcare deserts expanded. And the list goes on and on. None of this is good.
No, it is not. And it's hard to believe that a fairly robust public health system a year ago has been almost decimated in such a short period of time. But we've seen this over and over again by decisions that the Trump administration has made, whether it's in healthcare or getting food to people or you name it. So, Judy, let's give an overview of what the league position on healthcare is, both here in New York State and for the U.S. League as a whole, please.
So, the league in the US and New York State has three big healthcare goals. It wants one, universal, two, comprehensive, and three, affordable healthcare. Just think universal, comprehensive, and affordable. Now, what does that mean? But universal means equitable access for all residents. No rationing by income, gender, ethnicity, no pre-existing conditions. Most delivery near where you live. While comprehensive means equitable high quality, covering all essential care, physical and behavioral, and treatment, tests, including long-term care, as well as education about prevention of diseases and what it takes to prevent what a doctor does, health promotion, education, and all your medical needs above the shoulders, ears, eyes, teeth, brain. There will be no system-caused disparities of health outcome. It will also be affordable and feasible for patients, for providers, for taxpayers. It's affordable for patients because it will be financed through progressive general taxes, not regressive individual premiums out of pocket. So you never have to worry about paying for health care rather than food or rent or shoes for your kid. Medical debt will go away. Separated from being employed, if you lose your job, you don't lose coverage. It's also affordable for providers. Under New York Health, reimbursements will be raised for physicians and other providers who provide primary care and who serve in poor zip codes, meaning providers who serve in rural areas will be able to make a living. Even better, individual practitioners and small partnerships won't be strangled by corporate negotiating power when they want to work near family or where the need is great. And providers won't need to hire multiple billing assistants to handle denials and appeals. Think about your doctor's offices and how many people are there besides the doctor. In fact, doctors will save as much as 20 hours per week on filling out charts and computer forms, which are basically required by billing, and your doctor will be able to look at you, not their computer screen, during visits. Finally, it's affordable for taxpayers. We're currently analyzing, a small team of us are currently analyzing the budgets of a number of New York State counties, cities and towns, and school districts, because most public employees have some or all of their health insurance paid for, and counties also pay hefty contributions to New York State for Medicaid. New York Health, one county at least, would save 97% of its current healthcare spending. That's right. New York Health, which would provide even part-time employees with universal, comprehensive, affordable healthcare, would cost the county 3% of what it's currently spending. That's saving 50% more dollars than the county is currently collecting in property taxes. 50%. Under New York Health, towns, cities, and school districts would also see whopping savings as much as 15 to 20% of their total property tax levies. Now, this doesn't mean that the property taxes in your county are going to go away or for your town, city, or school district, but it does mean that there will be much more money in those budgets, and you as a taxpayer should have a say in how that money gets spent, including if some of these levies might be reduced. Stay tuned as we finish our analyses.
This amazing numbers there that you've just mentioned, and I'm looking forward to hearing more of the details. So, in reality, what the league goal is the same for the same high quality, affordable healthcare system that the rest of the civilized world enjoys, and we don't right here. So, the New York Health Act has again been introduced by the legislature for action this year. Passage would not only satisfy all of the league goals for healthcare, but would mean major savings for residents, for local governments, and for schools. Let's kind of go through it piece by piece so folks can understand what it would do for us here in New York State.
Well, first, as you point out, it guarantees universal and comprehensive coverage for every New Yorker. You can think of it as a Cadillac plan, a single Cadillac plan for everybody. If you live in New York, you're covered fully. Everyone gets the care they need. No one is left out. Our governor and legislators get the same health coverage that Uber drivers and food truck owners get, and that farm laborers get. If your assembly member wants something improved, it gets improved for you too, and everyone else in the state. So you can trust it will be high quality.
So let's dive a little deeper into just about what we're talking about with comprehensive and equitable quality. Explain how that would work, Judy.
So comprehensive and equitable high quality. Um, it's a very long list of things that for many people, it's either out of policy or you pay extra or it's out of network or there's some sort of exclusion. This is a single policy coverage that would include everything. You can go to the website www.nyhcampaign.org, NYH for New York Health. Campaign is spelled out. And see the very long list of every kind of needed health care you can think of. Now, note, it won't cover cosmetic care like liposuction or nose jobs. It only covers care that's medically needed. But if a physician prescribes it, if it's in a current public, private, union policy, any of those, it will be covered. It will cover your teeth, including cleanings and surgery and implants, your eyes, glasses and glaucoma, your ears, including hearing aids, and all your prescription medications with no cost sharing. It's all just part of your plan. This is what other countries have. It offers coverage as good or better than any public or private or union plan offered in New York State today, by design. It also includes full coverage of long-term care. And since there are no networks, you will have a choice of provider and hospital. Every provider in New York State will have to decide to be in and have their medical society negotiate their reimbursement level at a level high enough to keep them whole, regardless of where in the state they live. Or they will have to decide to be out, and then they will not be eligible for New York Health patient reimbursements, except for those patients who will pay in cash, and that will take a lot of patients willing to pay cash because they already will have paid for a New York Health, remember? So there may be a few such physicians on Park Avenue in Manhattan, but I don't think there are going to be many. And you'll just need to make sure that the physician you want wants you.
It certainly changes the dynamic of people who live in rural New York where we already don't have access to enough health care to begin with. And if this gives us better and more providers, then it is the answer to a lot of prayers, isn't it?
It certainly is.
So, of course, the key to high quality healthcare is paying for it, either out of pocket, as you just mentioned, or through the for profit healthcare companies, or through public funding like Medicare or Medicaid. So, how does the New York Health Act pay for care? Because this is the big difference between all of those other plans, isn't it?
So one of the amazing things that's very hard to keep your initially wrap your brain around is that instead of having the choice of which awful private insurance company do you want to have, a single payer insurance, meaning the government is footing the bill without a middleman between it and you, is incredibly cheaper. So 90 to 95% of New Yorkers will pay less, far less than what they pay now for healthcare. So let's discuss how much you might pay in taxes, or you can call them premiums if you like. People who earn less than $25,000 a year will pay nothing, and they will be fully covered. Babies, school children, full-time students who are studying, and they may be working a part-time job, but they're not they're not other, they're people who are investing in themselves. Those who are providing home care for sick or elderly family members. When my husband got sick, I cut back how much I was working a lot. Luckily, I didn't lose health care because it came from him. If you earn 75,000 a year, you'll pay about $1,000 in tax or premium, and your employer will pay about 4,000. Unless you're in a union that has a negotiated that your employer will pay all of your health care, and then you'll pay nothing, and your employer will pay 5,000, which is a lot less than your employer is paying now if you're getting health care. If you earn double that, your share will be 3,000, and so forth. How is this possible? Well, first, there will be 20 million people in this health insurance plan. And health insurance, like any other insurance, is about the risk of small payouts and catastrophic payouts, just like your house insurance, your car insurance, and others. So the risk of catastrophic expense, the kinds that put people in bankruptcy or uses up all their savings, will be spread across many, many people. And that means low odds of a crisis for you this year. Now, maybe lightning will strike you in some future year, but it's not going to strike you every year. And that means this 20 million people is a very large risk pool. Also, there are no middlemen taking profits or engaging in fraud or upcoding, and the administrative cost will drop from about 14% to about 2%. So Medicare, the VA, Indian Health Services, all have 1 to 2% administrative overhead. Private insurers are allowed to divert up to 20% of your premium dollar away from actual health care. And that 20% of your premium dollar, when you multiply it by all the people in New York who are paying for premiums, is billions of dollars. By the way, and that will go to that will not be diverted away from you. By the way, your progressive tax bill will be all you pay. There's no cost sharing, no copays, no coinsurance, no deductibles, no out of network. If you're on Medicare, you won't even pay your Part B premiums that are taken out of your Social Security or the Part D premiums. And when you show up at the ER, they'll ask, "What's wrong?" Not, "How will you pay?" If you lose your job, you do not lose coverage. If you hate your job, you can change jobs with no loss of coverage, no change of network and doctors. If you're staying with a spouse only because your spouse gives you health care, you don't have to. As a New York resident, you'll be covered because you're a person. If you're a small business that offers health benefits, you will lose the administrative hassle of constantly shopping when insurers change your policy and network and jerk you around on price. If you're a small business that doesn't offer health benefits, you won't be at a disadvantage when you're recruiting new employees or trying to keep employees who get offered jobs that give them health care. What's in it for providers and frontline doctors? Well, primary care doctors, pediatricians, obstetricians, midwives, and so forth will be reimbursed more than they are now. Hospitals that serve the poor will get reimbursed the same as hospitals in wealthy communities. Today, a doctor's income depends on the income of the people that doctor is serving. This is true for many providers, not just physicians. So, rich zip codes attract doctors and nurses and physical therapists to their zip code, and poor zip codes and zip codes that have few people, rural zip codes, don't attract anyone. Under New York Health, regional councils, that's geographic regional councils, can manage reimbursement and incentives like tuition forgiveness and other incentives to attract frontline providers who are in shortage so that they have the providers they need. And doctors will be able to hang out their shingle in solo practice or in group practices. Practices run by doctors, like Dr. Welby, who could afford to live in a community he loved. And let me repeat, every property owner will benefit, as will your local school district, your town or village, and your county. You and they will get significant budget savings and a more productive, healthier workforce, and it will stimulate the local economy.
Well, Judy, it's quite clear that never has the New York Health Act been more needed. In fact, it's the answer to so many of the ills of our current healthcare system, and it's something that we could enact this year if we can find the political will and the votes. What can we as citizens do to help advocate for better and expanded healthcare, both during the budget and the legislative session? What kind of advocacy is needed to get this over the finish line?
Well, first thing I would say is when you are talking to your legislators and your community, point out that the big beautiful bill, OBBBA, and other federal cuts have created a $13 billion hole in the New York State budget. And currently, there are no particular ways for filling that hole except for $3 billion for for New York Medicaid recipients that New York is required to give health care to, even if the federal government doesn't want us to. That's $10 billion hole. And New York Health Act will save 60 billion, which it will then use 40 billion to reinvest in higher reimbursements, paying for pharmacies, for prescriptions, paying for long-term care, leaving a $20 billion savings net, and that will more than cover the federal budget hole. So when you talk to legislators who don't like taxes, point out that we are going to have hospitals die and we're going to have New Yorkers die unless we figure out how to fill that budget hole, that health budget hole caused by the federal government. This would allow New York State to have some independence. You can read more about it by joining the New York Health Campaign. That's nyhcampaign.org. It's free to join, but it runs on a skinny budget, so donations are welcome. It's got hubs of individuals and organizations across New York State, so there will probably be a hub near you. You can also join and check the websites of LWV of PWM.org. That's my league, League of Women Voters of Port Washington, Manhasset. We usually have our healthcare priorities listed. Senior Statewide Action, which is www.nysenior.org, which also has a list of priorities, which for the healthcare ones, the League agrees with most of them. And pnhp.org, which has great info and action alerts and superb webinars. And then there is lwvhealthcarereform.org, which has great information on single payer. There's a lot of places. We'll put them in the notes.
We will definitely put them in our show notes so that people will have a chance to go to some of these websites that you just managed or mentioned rather. And I know you're always looking to expand the reach of your issue committee and bring in new people who have this concern and interest about healthcare. How can folks get involved, Judy?
Oh, we would love to have them involved, particularly if they either have aspects of healthcare reform that they are particularly interested in, or if they want to learn more about what they can do. If you're a league member, you can email me at lwv.nys.healthcare, one word, .update@gmail.com. The New York State League Healthcare Committee usually meets monthly on the third Monday at noon between January and June, and then three more times before December. If you're not a league member, consider joining. Dues or pay what you can with a minimum of $25 a year. It is worth it to help democracy and also to help health reform if that's what you want to do. You can find a league by Googling lwv.org space find a local league, and you will see a list of states. Click on the state and find a local league near you. So I hope you will do that. The league is a great institution. Um, it is nonpartisan. It will expect that you do your homework so that you don't say things that are just opinions. We really believe in footnotes. Um, but if you're willing to have civil discourse and talk with informed people, we would love to have you.
And that is a great advertisement for the league as a whole because it is a civic and a civil organization. And these days, those seem to be in pretty short supply. So it's important that we support organizations that are pro democracy and pro intelligent decision making. This business of creating public policy by the seat of your pants is just not working in this country anymore, is it?
No, it isn't. It isn't. And polarization is something we need to fight. And I believe that civil discourse and finding middle common ground may not be in the middle, it may be on the sides, but you have to find common ground, is the way to reduce some of the polarization.
I think you're exactly right about that. Well, Judy, thank you for coming in today. This is a big, complex topic. You have given us a tremendous amount of information about how the New York Health Care Act could work if we could get it passed. Let's face it, states are where we try things out and they make great role models for other states. If we could get this passed in New York, other states could take a look at our model and decide whether it's something they could make work in their state. So it's
I will tell you, there's 20 states that have single payer bills either in the works or they're trying to uh, to to hone them because legislation, when it first gets written, is typically not very good and it has to be revised until it's better. Colorado just passed a law that they're going to study single payer, and the Colorado League is excited about this. New York is the farthest along, but if New York passes this and implements this, or I should say when it passes it and when it implements it, other states will quickly follow. Same as with seatbelt laws, same as with, you know, uh, certain kinds of car emissions. They start in one state and then they spread. And this is something that many people have not heard of it because they go, oh, healthcare, too hard. And it's not that hard. It's hard because we live in a system where there are too many players making a profit and doing side deals, and this will simplify it, and it will be about you and your providers and good care.
Well, that is a goal we can all get behind. So thank you so much, Judy, for explaining it to us. And we will continue to follow this along as we go through the budget session and get into the legislative session here in New York. It is, after all, an election year, so maybe this is a good time for you to remind your legislators that this is something you care about and that you want to see them take action on it before they come and ask for your vote next fall.
I think that's a great idea. There are an increasing number of legislators who are running on this and supportive of it. And you should make sure that if they say they're a sponsor, that they talk about it and bring it up. It is not something that people don't want. It is something that people do want. And the legislator who is sponsoring it and saying that they champion it should champion it out loud.
Yes, they should. So thanks so much for coming in, Judy. I want to remind our viewers that these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters and the Potsdam Public Library. Until next time, remember, our North Country matters.